Thank you for everyone who is joining us. We are going to get started in about 5 minutes. If you can please answer these 3 questions by entering your answers into the chat to better help us further our discussion today, that would be greatly appreciated. And to make sure that our chat function is working today, thank you.
Welcome to those who just joined. If you'd like to take a couple of moments before we get started here in about 3 minutes, by looking over these questions and putting your responses into the chat, we would greatly appreciate that.
And thank you, Ms. Shannon Parker, for getting the conversation started in our chat. We really appreciate that. Everyone else, please join in the conversation by getting to your chat box and answering these 3 questions for us, please.
Good afternoon to those who just joined us. If you could take a couple of moments to look over these questions and put your responses into the chat, we would appreciate that to get our conversation started today and know some of your concerns and your familiarity with the Master Plan for Aging.
All right, 1 minute to start time. If you could take a moment to answer these 3 questions, or maybe just 1 question today, put it in the chat box. That would greatly be appreciated. And we will get started shortly.
Thank you to those who are putting your responses into the chat. We look forward to looking over those responses. With that being said, I would like to welcome you all today to our Engaging Stanislaus Master Plan for Aging event. We appreciate you taking the time to join the Senior Coalition of Stanislaus County as we explore the Master Plan for Aging and the needs in our community regarding affordable senior housing and caregiving. I would also like to take this opportunity to thank the SCAN Foundation and the California Collaborative for Long-Term Services and Supports for their assistance and support to make this virtual event possible. So a couple of logistics and housekeeping before we go further. So please keep your microphones on mute and turn your cameras off. This will help with connection issues. So if you could keep that microphone muted, unless you are a speaker or panelist. If you have questions, please put them in the chat and we will answer as many as time allows during our Q&A session. Again, this session is being recorded and will be posted to the Senior Coalition of Stanislaus County website, our Facebook, and shared with the SCAN Foundation. I want to mention that subtitles are available. If you're looking at your screen, at the bottom of your screen, it says CC Live Transcript. At the bottom of your screen, if you would like to turn on subtitles. So we want to make sure that you know that that is available. So the facilitators of this event, Healthy Aging Association is the facilitator of the Senior Coalition of Stanislaus County. Healthy Aging Association staff members present include myself, Jessica Innis, Samantha Borba, and our Executive Director, Diana Olson. The Senior Coalition of Stanislaus County was established to enhance the physical, mental, and social well-being while reducing fall risk for seniors and persons with disabilities in Stanislaus County in a collaborative community effort through advocacy, education, coordinated services, and best practices for independence. So our agenda for today, looking at our agenda, we have a very full schedule today, as you can see. After we briefly address the master plan for aging, we will focus on goal 1, which is housing for all stages and ages, and goal 4, caregiving that works today. So without further ado, we would like to briefly present the master plan for aging. So the main reason we are all here today is in regards to the California Master Plan for Aging and how and what that means for housing and caregiving. Aging is changing and it is changing California. We know that Californians are living longer than ever before, and come 2030, we will have more individuals in their later years of life. Governor Newsom's California Master Plan for Aging was released in January 2021 after review and input from local lawmakers and stakeholders to customize a plan for all ages and stages of life. By working together to have a plan in place as we all age, they developed 5 bold goals. So the first bold goal is housing for all stages and ages, which we will hear more about shortly. But in this goal, it addresses the need for housing and broadening the options for housing. This section also addresses the important components of shelter, affordability, mitigating homelessness, and thinking about safe living environments of older individuals as well as young people. Goal number 2, Health Reimagined, is an extensive goal about the infrastructure regarding long-term services and support. Our health is more than just what happens at the doctor's office. It is about being able to get the health care we need from home and how we can optimize our quality of life by aging well. Goal 3, inclusion and equity, not isolation. In this goal, we talk about making sure to address how we can embrace all of those in our society and recognize we all have periods of loneliness and isolation. Our ability to be included and not isolated contributes to part of a full life in a full community. This goal also discusses the creation of more opportunities for volunteering and active work as we age, and avoiding traits of discrimination, neglect, and exploitation. Goal 4, which we will discuss in further detail today, caregiving that works. I'm sure we all know someone in some capacity who has been a caregiver or needed a caregiver for a loved one or friend, or have benefited themselves from caregiving. A real challenge for family caregivers is experiencing the joy and sometimes the stress of making sure their loved ones are cared for in the best possible way. With a shortage of direct care workers, it's important to acknowledge all they do, especially in the past year, and support them in their work. And finally, bold goal number 5, affording aging. We have learned that our older years can be challenging, especially with the erosion of private pension, private savings, and Social Security unable to keep up with the rising costs of housing and healthcare costs. This goal addresses ways we could be able to work together and to make aging affordable for all, and have the ability to age with dignity and wellness. At this time, I would like to ask Supervisor Manny Graywell to welcome us all this afternoon and kick off our event.
Good afternoon, everyone. Manny Graywell with the Stanislaus County Board of Supervisors, representing District 4. Happy to be on this call and this very important discussion of answers that are going to come out through this program that's been put together by the Senior Coalition of Stanislaus County. I want to thank Jessica, Samantha, and Diana for putting this project together, because at the county, it's always an opportunity for us to help out with the senior population. And these are somewhat unprecedented times when it comes to housing because of the amount of people that are moving in to the county. Stanislaus County was one of the only counties in the state that has seen population growth last year. So that just makes it that much more important for us as a community to make sure our senior population, our veteran population has transportation, has accessibility to housing, has accessibility to services. So that's something that I know our Department on Aging and Veteran Services, which is ran by Margie Pellegrino. She takes a lot of pride in making sure that we have as many services as readily available in a timely manner to our senior population. I remember going out to the department and seeing all of the services, even the Meals on Wheels program, just check-in program where they're checking in on our elderly population. So a lot of the things that Jessica brought up in the initial introduction of today's event, I think those are at the forefront of what the county wants to make sure, because you know, when we talk about housing for all ages, that's a statewide initiative which percolates down to the county, because the county sometimes is where the rubber meets the road, and that's where we have to make sure that everything that's being brought upon at the state level to help our senior and veteran population, we're able to incorporate that here at the county level. So this program and this event and many others like this is exactly what is needed. So I commend everybody that's taken the time. I know a lot of planning. I know there was a planning session a couple of weeks ago, and it was set up to be a really well-ran program, making sure everybody gets their questions answered. The presenters get to give their main points, and then also allow for any further discussion if needed. So once again, I'm happy that we're having this conversation at our community in our region, and I'm glad that Stanislaus County is part of it. I appreciate being able to come and introduce myself, and I thank everybody that's on the call today. And if there's anything my office can ever do, please feel free to reach out.
Thank you so much, Manny, for being here with us today and being a part of the conversation. So we appreciate you being here and kicking us off for this event. At this time, I would like to introduce Barbara Koss from the Stanislaus County Regional Housing Authority. She will be getting us started with talking about housing for all. And again, Ms. Barbara Koss from the Stanislaus Regional Housing Authority.
Hi, thank you. I just want to let you know right up front, the whole internet went out in my house, and so I'm on a backup system, so I apologize in advance if there's any glitches, but as we all know, we go forward. So thank you. My name is Barbara Koss. I'm the CEO of Stanislaus Regional Housing Authority, which encompasses Stanislaus County, but also 7 eastern Sierra counties, including Amador, Alpine, Calaveras, Inyo, Mariposa, Mono, and Tuolumne. When that first happened, it was like the 7 dwarfs. I always forgot one, but I think I've gotten it down now. That's about 21,000 square miles of territory that we work with affordable housing. And so we can kind of get a bird's eye view as well as an up close look in Stanislaus. I was asked to speak about affordable housing today, and you know, I do a bit of speaking and have some great stories, and over the years, you know, some funny things. I was telling the folks ahead of this that I've just totally rewritten my speech in the last 48 hours. And the reason I have is because we have some new statistics in, and things are quite serious. People are frightened. There's a lot going on right now. We all know about COVID. We all know about the wildfires and everything. And so what I want to do today is just kind of offer you where we're at, what can you do, if anything, and give you some tips to connect seniors to housing, because I understand the desperation that there is out there, and we want to do all we can to address it. So right up front, I'm going to answer some of the most common questions that I get to make sure that I have time to do that. The first is, how do you get low-income housing like Section 8 or public housing in Stanislaus County or in the other counties? The answer is always the same, and it's been the same for 35 years. Get on a waiting list. Get your clients on any and every waiting list that you can, whether or not they qualify. It's essential. Get on a list. Don't worry if they're qualified now, they might be later. Don't worry if they're hesitant. It's essential that you get on a list, because lists ebb and flow. And so it's really important that when that emergency time comes, your client is closer to the top of the waiting list rather than trying to get on a closed list. The second thing I'm asked frequently is, what is the definition of a senior? In our world, it can be anything from 55 to 62 and up. Most of the time it's 62 and up, but it depends on the program. So I revert back to number 1, get on the list. Ask if you can, if your client qualifies to get on the list, get on the list. The next thing is, what is low income? Who qualifies? And that varies. In the state of California, low income is 140% of area median or below, and it depends, the income depends on the household size, the number of people in the household. We serve everyone from homelessness to home ownership and workforce housing. And so the moral of that is that low income is a wider range than you might think. So back to 1, get on the list. The next thing is, what if the senior I'm working with isn't quite sure if they want to live in affordable housing? Get them on the list anyway. It's better to have the option of housing when they need it and say no than not to have an option at all. Do the senior properties that the Housing Authority owns allow pets for seniors? Yes. We may not allow a rattlesnake, but if it's a little poodle or something like that, yes, absolutely. We understand the extreme importance of having a pet for many seniors, for the company, the emotional support, everything along that line. Is there a shortcut which I can do to get my client in housing? We only have one right now. We have something called an in-place preference. And so if you have a senior who is in place and they've been renting somewhere and their landlord is willing to rent to Section 8, there's an opening for in place. It's called in place preference, and you can get your client on the Section 8 waiting list. As a matter of fact, that's the only way you can get your client on the local Section 8 waiting list. The other shortcut is to watch the waiting list and the housing authorities around. I don't know if you know this, but you can get on a Section 8 waiting list in Alameda County or San Joaquin County or Fresno County when it's open. So those are some of the shortcuts. Others I'll give you just a little bit later, and I'll run through them. But those are the questions that I'm asked frequently, and I wanted to kind of go through those to make sure that I had time to address them. So now back to the speech making. The Housing Authority serves a lot of seniors. Right now, we provide subsidy through programs such as Section 8 for a little over 3,300 seniors. Households, that represents about 9,200 individuals. So in our voucher program, the average senior household is actually 3 people or 2.5 people, however you cut that. And actual housing that we own or manage or operate, we have 1,062 units that serve seniors, or seniors are in right now, and of that 3,200, a little more, individuals. So we serve quite a few, and that sounds really good until you look at our waiting list. And so I hope you're all sitting right now, because this is Zoom after all. Right now on our waiting list, we have over 13,000 senior households. Our waiting list has not opened completely for Section 8 since 2010. That's 11 years ago. And so I'll repeat that. We have 13,544 senior households currently on our waiting list. The need is dire, and it's important to do everything that we can to address this. And so what are some of the things that the Housing Authority is doing and things that you can look for? Well, the first is the in-place preference. And I'm going to say this probably 50 times today, but try to get on that list. If you have a senior in stable housing, but they can't afford it for much longer, get them on that list. So what's caused this problem? Well, you know, we all know about the housing crisis, but there's a lot of things that have added up that have caused this problem and that we need to learn from going forward. One of the first thing is that some things that were enacted to help have had an adverse effect on seniors. In 2019, our state of California legislature passed a law capping rental rates. So in other words, you couldn't raise your rent for a rental beyond a certain percentage or point, according to a formula to the cost price index. Well, what happened is we had many compassionate landlords in our community who were renting to seniors for a long time and had kept the rents artificially low because they had good tenants. But with that law, the landlords felt that they couldn't put their benchmark that low, that they needed it up to market rate, because after that, they would only be able to increase it a certain amount per the new law. So we had landlords raising the rents at the end of 2019. And in some cases, we had seniors who had been paying $500 a month for 10 or 15 years, all of a sudden with an $1,100 a month rent. And the rush to do that caused a lot of seniors to be either displaced or to start going through their savings. And so that law was meant for compassion, but what happened is it really put our seniors in a dire situation. The second thing that was really meant to help, and it has helped many, was the eviction moratorium for COVID. Obviously, a lot of people weren't able to work, businesses shut down, but what we're seeing as the after effect of that is a lot of landlords, because they were having such trouble paying their own mortgages on their rentals because they weren't getting income in, have decided not to be landlords anymore. The county and the state have worked together in the city to do an emergency rental assistance program, but it doesn't cover everything. And we have this vast amount of landlords saying, I can't do this anymore. And they're selling the rentals, even those that have had long-term renters and up in before the COVID-19 spike, they've done, you know, just fine. And at the same time, we had wildfires in several of the counties around us, burning up some of the affordable housing stock, bringing people to here. And then people from the Bay Area all of a sudden could telecommute. Many tech companies decided to get rid of their buildings and just telecommute because after the COVID, they figured out they could do that. So we have more people here snapping up those houses to live in, and then investors also getting the houses. And if you're an investor and you buy a house at a certain higher rental or market level, then you are going to raise the rent in order to pay your mortgage. So it's been this perfect storm of activities that's really impacted our seniors in a negative way. And again, many of the things that have happened, like the eviction moratorium or the rent cap, were meant to help people. And so we have learned some lessons from this in our advocacy of, what exceptions we could do. For example, a landlord that was doing an under market rent for a senior, could they have an exception until they rent it to the next person? Those sorts of things. It's telling us how to advocate, in other words. So with that, all that good news, what are some options and things that we can do? One of the first things that I cannot stress enough is if you have a senior that's in a good to fair rental situation that's stable, in social and supportive services, do everything you can to keep them there. If they have a safe place, if they have a decent place and they can afford the rent, do what you can. Watch for the red flags. Watch for things that might get them kicked out, like hoarding, like letting a grandchild who brings trouble into the house, or moving in 2 or 3 families, or just watch out for them to help them keep the stability in their rental situation. Because as I said before, we have 13,000 households, senior households alone on our waiting list. If someone's in a stable situation, please do everything that you can to support and keep them in that situation. The second thing is, try to have your seniors open to innovative things. At the Housing Authority, we opened up a single room occupancy through the mission that serves senior women. We're working on workforce housing, and it's not senior housing, but certainly seniors can live there like anyone else. For homeless seniors, working with the referring agencies for something like Kansas House. In other words, get sheltered. It may not be ideal for now, but the housing market ebbs and flows. And sometimes we have to be a little creative and do something that may not feel ideal in order to be housed. Another thing is, make sure that your seniors are working with any other case manager besides senior case management, because there may be avenues there. That leads me to the next thing. Try to look at seniors in another light. In other words, don't necessarily identify them by age, but if they're veterans, if they have mental health issues, if they have disabilities, all of those things may lead to housing options where it's not necessarily senior housing, but it's another type of housing that they can get into. If you can certify a disability in a senior, that's a preference for housing, especially government subsidized housing that they may not have already. So speak to your seniors and see if they have any other identifying things that might lead them to housing. The next thing is to advocate for building housing and housing resources in the most flexible way. What we're seeing now is a lot of money that's really uber focused on one specific group. For example, chronically ill who are or chronically mentally ill who are homeless with an addiction is one of our housing funding sources, rather than here is affordable housing, what do you need in your community? What we see with our legislature and with the federal legislature is that they're kind of like Pac-Man, or if you've ever gone to like a 5-year-old soccer game where they're all around the ball, and what happens is they learn a term or they learn a specific need and they throw all of their funds and their money into that instead of looking at the whole picture. Let your congressional representatives and your folks in the state legislature know that seniors fill all the categories and that we really need to have housing for seniors in every single category. So again, I haven't really given anyone the magic bullet, but if I could recap, it would be, first of all, get on any list you can get into. Keep your seniors as stable in stable housing that they can be in right now. If they can be flexible, whether it be relocating or thinking of a different type of housing or doubling up, suggest that, and then advocate for affordable housing and more flexible housing. So that's what I have to offer today. I know it's not the magic bullet, but hopefully there's just something that you can take in there that might help you out.
Thank you so much, Barbara. We appreciate your time and for expressing the needs and challenges regarding housing here in Stanislaus County. Thank you for your time. And next, we're going to continue with this conversation on housing by welcoming our panelists who will assist us in answering a few questions around housing. So these are our three panelists, if they can work on turning on their cameras. We have Jenny Canoyer, Modesto City Council, Dana Bailey with the Stanislaus County Community Services Agency, and Maren Pitt, Affordable Housing Advocate. We'd like to welcome them here as we go through a variety of questions today. And so we're going to get started with our first panel question. Jessica? Thank you. All right, so our first question to our panelists today is going to be, are there any current housing programs available or in the planning stages for older adults and persons with disabilities? I would like to first propose this question to Jenny. Jenny, can you take this question away, please?
Thank you very much. And excuse me, this smoke is like, you know, ruins my voice. We as a city right now don't have any kind of a program for specifically people with disabilities and low income. The last thing we ever did recently is the one on Carver, and that right now is about the only low housing income property that we're using. It's really difficult for a city to provide housing because we actually, you know, CBDG funds, ESG funds we get for that, which is not really large for building or actually construction of low income housing. So it makes it difficult. People wonder why we can't do that. It's as everyone knows, it's very, very difficult to get the financing to build housing, to find the property, to find a contractor or a developer that's willing to go into low income housing, and also to find somebody who will manage it. So right now, we do not have a program, but we rely a lot on Barbara Kraus and her program and her many programs that they have, which always astonishes me. So we depend on them to really help us as much as they can. So no, we don't have, unfortunately, we do not have a planning stages for older adults and persons with disabilities. We just don't have that right now.
Thank you, Jenny. I'd like to propose the same question to Maren.
Yeah, when Barbara was talking about the perfect storm, there was two other things that have happened since 2012 that have really hamstringed certainly local governments from building affordable housing. That speaks to what Councilmember Canoyer just mentioned. One was the dissolution or redevelopment money, which was there was a set aside for affordable housing. So most affordable housing is financed through several sources, but you need the primary funding sources through the tax credits. There are a federal low-income housing tax credit, and the state throws in a match. But during the Trump administration with the tax cuts, they also cut the tax credits. So for the last 4 or 5 years, the amount of tax credits, which is really a unique and very effective public-private partnership way of creating financing for affordable housing, went from competitive to cutthroat, and it just put a real bottleneck on getting projects off the drawing board and packaged into construction. And so, I think most cities that are large enough have entitlement funds through the United States Department of Housing and Urban Development that can leverage them and participate in that weaving of money. And it really is an art of weaving money together. Regular housing developers, affordable housing development is not for the faint of heart. And just because you know how to build a residential subdivision doesn't mean that you know how to develop affordable housing. Because in addition to just the more difficult ways of financing it, you also need to provide the follow-up relative to support services. And this is either for families, but also specifically for seniors. And it has to be located where seniors can access things like transit and other kinds of things. So it's out there, and if there is a political will and they're willing to engage in partnerships and collaborations with nonprofits, and there's many of them, like Visionary Home Builders, Self-Help Enterprises, EAH. There's many of them, but it's got about somebody who needs to take a leadership role in bringing everyone together, and there has to be a political will. And again, being smart about picking right selection of sites, that you don't ship them out in the middle of nowhere. Especially senior housing needs to be close to medical services, transit, public transportation, grocery stores and pharmacies. So, it takes a little discernment and some strategic thought into trying to figure out where to put a project, and then the political will to sort of draw everyone together and bring the project to fruition.
Thank you, Maren. Same question to Dana.
First, thank you for having me. And I'm here really from the Community Services Agency, and the Community Services Agency really, we aren't in the business of building houses. We are here to really provide services to the seniors and support them in either their attempts to age in place in their own home, or if their attempts to do that in what affordable housing is available. And I was listening to what Barbara said earlier, and the thing that came to mind was housing takes a while to build. And, we know that we're in a very serious housing crunch right now. So we've really got to be innovative about how we can support seniors and how we can support them in whatever circumstances they're currently in. So if that means that, we are partnering with nonprofit agencies like the Senior Advocacy Network that's working in the senior community to talk about home sharing. That's an important way that we can have seniors work together. For seniors that maybe have too much house, maybe they can partner with a senior that doesn't have any housing or can't afford the housing that they're currently in. It's supporting nonprofits like that are coming up with those kinds of innovative solutions like home matching, or even talking to seniors. We noticed that a lot of us have noticed that our neighborhoods are aging, and talking with the seniors that are there in their homes about forming networks. There's this village concept where the neighbors have like they treat their own block like a village, and they have each other's phone numbers, and they're making sure that everyone has they're getting food on time, or that they're if they need doctor's appointments and somebody can drive and somebody can't, they're working together to make those things happen. So finding ways for us to support those kinds of concepts. And then there are exciting possibilities for partnering with other types of agencies or departments that are also looking at the housing crunch. We know that colleges are having a very difficult time with seniors that are, or with students that are having a hard time finding housing. So if there's a way that we can match students and seniors who have, or people that are empty nesters with students who can take a student in and allow them to live in that home and pay a little less in rent in exchange for some support around the house. It's those kinds of innovative solutions that we have to come up with and work together to bring to fruition to solve some of the housing crisis while we work on developing and building new housing.
And thank you so much for answering this question, ladies. I think that was an excellent way to talk about what are current housing programs available, what is not available, and how we can be innovative to hopefully address these issues in the future. So our next question is for question number 2. Is there a consideration when making an apartment complex to designate a section or percentage for older adults or persons with disabilities? For this question, we're going to start with Maren.
Yeah, when you build multifamily under the current building code, I believe that for so many units that you construct new, you have to have at least one ADA unit per every so many regular units. So there is some attempt to address the issue with disabilities. We just haven't seen a lot of apartment construction in Stanislaus County. It's starting, and we've got some under construction in Turlock. And one of the things that Turlock has talked to some of these apartment developers about is buying down affordability, and you could make them restricted for seniors, especially like at a ground level where they were more accessible and not upstairs, or unless they have an elevator or something. But you can buy down the affordability and come to an agreement with a current market rate developer to restrict rents on a certain number of the units and make them available to either low-income families or particularly seniors. And seniors don't need 3 bedrooms. Typically, you're talking about usually a studios or 1 bedrooms and occasionally 2 bedroom if they have a caregiver. But there is, again, it takes somebody with a lens that understands what you're trying to create at the end to weave options into the process, like you can buy down affordability on a certain amount of units, and then you enter the jurisdiction enters into an agreement with that developer, and they have to report annually who the tenant is, what their annual income is, and that they're adhering to the terms of your affordability agreement and your restrictions. So there isn't anything in stone that's necessarily required beyond what I mentioned. For so many apartment units, you have to have an ADA unit. That I know is required under the building code, but there is also every city, and even in the county, and it's general plan, which is the land use constitution, has what's called a housing element. And in the housing element, those jurisdictions commit to building certain kinds of housing types. And it's easy to say, I want to build senior housing on paper, but they've got to report on it annually to the state of whether or not they're actually really doing it. And I think that there's a real place for advocacy here to make sure that cities aren't just talking the talk by saying, yes, we believe in senior housing, and we've put it in our plan, but then don't do anything about it. You know, it's required of them to perform, and it's tied to other state funding and other kinds of compliance. So, you know, cities just can't say, I want to do it, and then don't really follow through with it.
Thank you, Maren. Jenny, would you like to answer the same question? And you're currently muted.
No, I don't, you know, I kind of would repeat what Marion Pitt had to say. That, you know, there is involved in when a new developer builds a certain number of houses, they're supposed to set aside X number for people with disabilities and low income. And sometimes it's not as affordable as people think it would be for people that, you know, have low income and that, you know, that need affordability or that are on, you know, have some kind of disability. I think it's really difficult to get our developers to agree to, you know, follow the rules and have so many, but it doesn't make any difference. We're so far behind now that it's just going to take a tsunami of building of housing to try and catch up.
Thank you, Jenny. And Dana, same question?
Sure. I can't really talk about the development of housing, but I can speak to the housing that seniors are currently in. And many of us are, you know, working with seniors that are already in a place that really just needs a few things to help them to stay in place if they can. So it's how do you find programs and services for those seniors to help them make accessibility changes that will make it easier for them to stay where they are and age in place, particularly if they've got a routine or a network where they are. So it's working with seniors that, you know, to really pay attention to their current living conditions where they are, see if there are small things that can be done to make where they live more accessible. And also there's working with programs that are available to help seniors to make where they currently are living more accessible. There's no reason why a senior can't ask a landlord or if they're renting or someone else that can advocate for them to make accommodations to the unit that they're currently in. And sometimes it's something as simple as changing a doorknob so that they're not twist turn, they're just a handle, or even changing a bathroom so that, you know, we've got things that aren't trip hazards in the bathroom. We've converted tubs to shower units. Those types of things, those are things that can happen in a current apartment or in a current complex where a senior lives. So it's advocating for the seniors so that where they currently are, if they can stay where they currently are, given that the way that the market is right now, any way that we can help a senior to stay where they are, remain comfortable, get them access to programs that can make where they live more accessible, or make accommodations where they live so that the unit that they're in is more accessible, or even if they're in a home, if there's a housing rehabilitation program that can help make their home more accessible for them. Those are the kinds of things that we could be thinking about right now.
Thank you, ladies. Thank you for talking about the considerations when making an apartment complex and ways to make our homes safer to help them live in their homes longer. So we have time just for one more question. So our next question is going to be, what are ways to bolster production of more housing options to age well in California suburban, rural, and urban communities? We'll start with Jenny on this question. And you're currently muted, Jenny, when you're ready.
Okay, let's see. What can we do to bolster the production of more housing options? I think a lot of it is what we've spoken, what has been spoken about, how that there's more access to houses that are built that are more affordable, that seniors and actually people with disabilities could access. So, like I said, it's really difficult. I mean, people, they come and present plans. It goes to the planning board, and we just have to encourage. I think we really need to encourage the developers and the people in our community to realize that there is this need, because it's going to take all of us. It's not going to be one portion of the problem. It's going to be all of us working together to try to solve this. Whether we're going to be able to solve it, we maybe can make a little dent in it, which would be nice. But it's going to take the community, the developers, the elected officials. It's going to take all of us working together to try and see how we can improve this really dire situation right now.
Thank you, Jenny. Maren, same question.
The pandemic has, been difficult on everyone, but I think out of it has come some new ways of thinking about things. So, we've seen, big retailers like Sears and Montgomery Ward's that, they were on their way out before the pandemic. And in some respects, that was sort of the last nail in the coffin. But those are really big retail spaces. And I think that there is a revisiting that retail should just stay retail. And that I think that there is a huge opportunity to do mixed use of some of these big spaces. And I think that local government and city councils and county supervisors have to be open to saying, okay, well, this is different and out of the box, but I think we should try it. So, theoretically, you could build a senior housing tower where the Sears building was, at Vintage Fair Mall. All of the services and the transportation and the bus system is all right there. You could do different kinds of things. There are big old retail spaces on McHenry Avenue that where the old Long's Drugs was. I just drove by there yesterday. That could be converted into mixed use with like a pharmacy and maybe a dry cleaners and a beauty salon and a whole tower full of senior housing, and mix it up. And I think we've got to look at the lenders that don't like financing those kinds of things to say, look, we've got to figure out to do something different. And, you're going to have to look at it through a different lens because it is for the greater good. And so I think we just have to be open to these kinds of out of the box thinking, because I think, to Jenny's point, we need a tsunami number of housing units, but I think with a willingness, I think we could put a really sizable dent in it and do smart growth at the same time, where we're not paving over green space, but we're going back into something that's, well, I mean, I'll say it, the Long's Drugs on McHenry Avenue is kind of blighted. And wouldn't that be nice to put in a couple of senior housing towers and some open park space? Senior housing doesn't need a lot of parking, and it's right on a transit line. To do something different and be creative, and at the same time, really provide quality and affordable options for senior housing.
Oops. Thank you, Maren. Dana, would you like to wrap up this section for us today?
Sure. I think that what I would recommend is get involved. It's finding out what is happening on the local level. Get involved with your area agency on aging. Find out what's happening there and how you can help to advocate on behalf of seniors through that process. Go to a city council meeting, go to a board of supervisors meeting, find out what's on the agenda when they're talking about housing. Listen to the planning commissions when they're talking about the developments that are coming into town. It's really coming together as a community and paying attention to what the focus is in the community and being involved and a part of the conversation when these types of developments and proposals come to a local city or to a county. Understand what the developer is proposing and where is there a potential fit for some senior housing. When like Maren said, when there are retail opportunities in different places, we can go talk to some of the malls and say, hey, what's your use of this space? And is there some way that we can advocate to have some of the things that we would want for our seniors here? So really understanding what's in the pipeline, making yourself an advocate for seniors by going to meetings and reading through the minutes and understanding what's being proposed, and then taking an action to talk to our supervisors and our council people about why this is important to our community and how you'll be able to help them when they're making these kinds of decisions.
Thank you. And thank you to our three panelists for wrapping up the conversation regarding affordable housing. And thank you to everyone who has put something into the chat box, either a question or a comment. We will be addressing all questions at the end of today's event. Next, we will transition into our next topic, caregiving that works. We have three speakers that will take us through the conversation regarding caregiving from a variety of different perspectives. For their full biographies, feel free to visit the Senior Coalition website. Our first speaker that we will have today is going to be Yi Vu of Valley Caregiver Resource Center. Yi, thank you for joining us.
Good afternoon, everyone. Thank you. Glad to be a part of this exciting event. As I said, I am the program manager at Valley Caregiver Resource Center. Before I go on to discuss about caregiving that works, let me give you a quick overview of what we do at, some facts about Valley Caregiver Resource Center. So we're founded in 1988, nonprofit. Most of the services are provided to our communities at no cost. We receive federal, state, and private grants. We serve 9 counties, as far as the north to Stanislaus County, down south to Kern County. We are part of a statewide system of California Caregiver Resource Center. So anywhere in the state of California, there is a center just like ourselves. And we are also host to the National Family Caregiver Support Program in certain counties. Let's go to the next slide. Caregiving that works. For 33 years, we have emphasized the importance of taking care of the caregiver. So we're quite excited that we are part of the master plan. I think caregiving and aging goes hand in hand. In order to age healthy, we need caregiving. And at some point in life, as we age, we lose strength in our muscles, develop a condition that requires caregiving. Let's go ahead and move to the next slide. So when we talk about caregiving, we know that last year and the year prior to that, COVID-19, that there was shortage of private care providers, but we know that most of our caregiving is provided by the informal caregiver. The caregiver is not getting paid. Roughly about 17.7 million caregivers are informal caregivers. And demographic, look at it, 60% of those are women, 54% of caregivers are 50 and older, approximately 50 million, and 60% of caregivers are employed at some point. Let me just move this here. Can't see. And caregivers really help reduce hospital readmission. Caregivers are the ones that help the care recipients stay on their care plan. We also see more and more that caregivers are caring for their elder parents and also taking care of their grandchildren as well. We will see that as without proper support and assistance, we will have increase in some of these conditions as caregivers, is that increase in depression, stress, frustration, participating in unhelpful patterns. It could be drinking, it could be drug uses, and also abuse towards the recipients, heart disease, low level of self-care, and feeling obligated to provide that care. So let's move to the next slide here. When we talk about caregiving that works, what do we need to do to help support the caregiver? We need to provide them with adequate, assistance, emotional support, physical support, financial support. At Valley Caregiver Resource Center is that upon contact, we assign a caregiver with a consultant who is their advocate, who's their educator, who takes them on this journey and connects them to the resources in the community. We've been doing this for about 33 plus years. We know that it works. So let's move on to the next slide here.
Yi, would you mind moving a little closer to your microphone?
Oh, sorry about that. Oh.
No problem.
Okay. All right. So what kind of help do caregivers need when they come in contact with us? We know that caregivers often put their own needs on the back burner. And in addition to the emotional support, caregivers need respite. They need a break from the 24 hours or 7 days care. They need that break so that they can continue to provide for their loved one at home as long as possible. And we look at that opportunity for break in different forms, in home and out of the home. So respite can be in many forms for the caregiver. Let's move on to the next slide. The next slide, please. In addition to giving them the break, we need to give caregivers the proper tools, education, how to respond to challenging situations, better coping mechanisms. So education in classes, these are at this Caregiver Resource Center. I would say that this is second to probably respite care that our caregivers really accesses information and knowledge, more about their current loved one's condition, what's in the community that they can tap into as well as resources. Let's move on to the next slide. And counseling. We provide caregivers with the opportunity to talk at many different levels with our staff and support groups that we have that they can meet with other caregivers as well, but also the opportunity to talk to a clinician or therapist to help process their journey and explore and problem solve and see what works for them. So individual counseling services. And as far as legal consultation as well, too, that I didn't mention on there, but opportunities that may not be in place and that needs to be in place. And support groups, we have probably about 20 support groups that are ongoing on a monthly basis in the whole 9 counties, and the opportunity to connect with other caregivers. And that should be, again, phone number here, our 800 number that you can also get onto our website and sign up with services. We believe that caregivers need as much support as possible for them to continue to care for their loved one at home as long as possible. They are 1 in 6 individuals providing some type of care. And to age well in place, we need as much care as possible.
Thank you, Yi, for representing not only Caregiver Resource Center, but also to help us understand services that the Caregiver Resource Centers provide for caregivers and their families, along with the virtual education and support available for caregivers to meet their needs and overcome any challenges that they might experience.
Certainly. Thank you.
Again, if you want more information, you can visit their website or give Valley Caregiver Resource Center a call. At this time, I would like to invite Denise Davis, our next speaker from the Alzheimer's Association, who will be discussing caregiving needs and challenges specifically for those with Alzheimer's and dementia. Denise.
Thank you so much, Jessica, and thank you for inviting me to speak today. As Jessica mentioned, I'd like to share some of those challenges and needs of individuals living with dementia and their care partners and share some solutions. Next slide, please. Some of the challenges we face in our community today. This spring, the Alzheimer's Association released the 2021 Alzheimer's Disease Facts and Figures Annual Report, providing an in-depth look at the latest national statistics on Alzheimer's incidence, prevalence, mortality, costs of care, and impact on caregivers. For the first time, the accompanying special report, Race, Ethnicity, and Alzheimer's, examines perspectives and experiences of Asian, Black, Hispanic, Native, and White Americans in regard to Alzheimer's and dementia care. I encourage you to download the full report at alz.org/facts, which highlights key statistics from the report. The special report reveals that 2/3 of Black Americans believe it's harder for them to get excellent care for Alzheimer's disease or other dementias. Likewise, 2 in 5 Native Americans and Hispanic Americans believe their own race or ethnicity makes it hard to get care, as do 1/3 of Asian Americans. The experiences and views of discrimination expressed by respondents in both surveys are also reflected in their views on medical research. Nearly 2/3 of Black Americans believe that medical research is based against people of color, a view shared by substantial numbers of Asian Americans, Native Americans, and Hispanic Americans as well. Only half of Black Americans trust a future cure for Alzheimer's will be shared equally regardless of race, color, or ethnicity. Also, according to the report, older Blacks and Hispanics are disproportionately more likely to have Alzheimer's disease and other dementias. In addition, both groups are more likely to face misdiagnoses than older whites. Discrimination, lack of diversity among healthcare professionals, and mistrust in medical research create significant barriers to care and demand the country's full attention. The Alzheimer's Association is committed to building trust and inclusion with diverse communities so that together, as we work to advance science toward Alzheimer's and other dementia treatments, we can achieve safety, efficacy, and accessibility for all. And we are committed to addressing the disparities identified in this report in multiple ways, including research, public policy, health systems, and partnerships. Next slide, please. Some of the needs we see in our community still today include increased public awareness and signs and symptoms of dementia. Since 2011, the Medicare annual wellness visit has included a required cognitive evaluation. A survey by the Alzheimer's Association found that only 1 in 3 older adults were aware that these visits should include a cognitive assessment. Furthermore, while 82% of older adults believe it's important to have their memory and thinking checked, only 16% report having their memory and thinking checked. About 93% of older adults say they trust their doctor to recommend testing for memory and thinking problems. However, despite 94% of primary care physicians stating that it's important to assess all older patients for cognitive impairment, fewer than half say it's their standard protocol to do so. The primary reasons given by surveyed physicians for not assessing older patients for cognitive impairment are: number 1, the patient presents with no symptoms or complaints, and number 2, lack of time. We must do better. The next is improve early detection and timely diagnosis of Alzheimer's and all other dementia. Families need access to treatment options. We need an opportunity to participate in clinical trials. We deserve a chance to prioritize one's health, to plan for the future, and to have emotional and social benefits. Early diagnosis saves costs of medical and long-term care for both family and the US government. Among all Americans alive today, if those who will get Alzheimer's disease were diagnosed when they had mild cognitive impairment before dementia, it could collectively save approximately $7 trillion in healthcare and long-term care costs. Number 3 is target outreach to individuals and communities at high risk. Examples include African American, Asian Pacific Islander, Latino and women, with strategies to reach underserved and underrepresented populations. Examples here include LGBTQ, persons that live in rural, persons who live alone, and persons who have younger onset dementia. Next slide, please. And an opportunity to reach more people to increase public awareness, the Alzheimer's Association is using Project Extension for Community Healthcare Outcomes, which is a free telementoring program that uses video conferencing to build workforce capacity and improve access to specialty care in local communities. Specialist teams and primary practices collaborate and share information and learn from each other via case-based discussions. During this 6-month program, primary care providers gain knowledge, confidence, and access so they can deliver excellent care to patients in their own communities. In effort to reach all of our communities, the US Study to Protect Brain Health Through Lifestyle Intervention to Reduce Risk, or US Pointer, is a 2-year clinical trial to evaluate whether lifestyle interventions that simultaneously target many risk factors protect cognitive health in older adults who are at increased risk for cognitive decline. US Pointer is the first study to be conducted in a large group of Americans across the United States. Similar to other trials globally, Pointer entered a pause phase in the early days of COVID-19. However, on July 13th, the trial was restarted and we're actively recruiting participants. For more information, you can visit the website up here on the slide. We're also seeing a great opportunity to increase public awareness with our International Spanish Symposium and our Alzheimer's Association International Conference. Next slide, please. The Alzheimer's Association is the leading voluntary health organization in dementia care, support, and research. We have transitioned all of our in-person programs to virtual platforms during the pandemic, either by webinar or by phone. These programs are available to you for free, and you can find out more information at communityresourcefinder.org. As you can see on the slide, there are many, many topics offered and more. Next slide, please. In continuing on some of the care and support programs, whoops, wrong way. We offer on this slide, we show care partner support groups, early stage programs for persons living with dementia, peer-to-peer social engagement, and multilingual education and support programs. And those include Spanish, Chinese, Vietnamese, and more. Next slide, please. So it should actually read Community Resource Finder on the slide there, maybe slide 7. So you can help find local resources in your area, local doctor, there you go, and medical professionals, diagnostic centers, clinical studies and trials, respite services, including in-home care agencies, adult day programs, residential care facilities, and more. Next slide, please. When facing Alzheimer's disease and all other dementias, there are a lot of things to consider. Alzheimer's Navigator helps guide caregivers to answers by creating a personalized action plan and linking you to information, support, and local resources. And my last slide, the Alzheimer's Association 24/7 helpline is available around the clock, 365 days a year. And through this free service, our specialist and master's level clinicians offer confidential support, information, and guidance to people living with disease, caregivers, families, and the public. And you can learn more about the symptoms of Alzheimer's and other dementias, find out about those local programs and services that Yi mentioned, and our next speaker will mention, have information about legal, financial care decisions, as well as treatment options for managing symptoms, have the information in your preferred language through our bilingual staff or translation services, and also through TTY. Thank you so much for your attention and your time today. I'll pass it back to Jessica.
Thank you, Denise, especially for your expertise in the Alzheimer's and dementia realm. I really encourage participants and attendees here today to visit their website, because I don't know if you'll remember everything that Denise said, but there is a lot of good information and programs and services there available at the Alzheimer's Association website. So I encourage you to check out that website. Thank you again, Denise. And then at this time, I would like to introduce our next speaker, Ms. Gina Innis from In-Home Supportive Services, Community Services Agency. Gina.
Good afternoon, everyone. It's so exciting to be talking about the Master Plan for Aging, and really starting that conversation about how we can develop our own Master Plan for Aging here locally. So I first want to thank the Senior Coalition for this opportunity to participate in today's event and for introducing it in our community. So as Jessica mentioned, my name is Gina Innis, and I am a program manager with the Community Services Agency. Today, I'm going to talk a bit about the in-home supportive services program and what we do to support caregiving that works. So just to begin, some background and information about what IHSS is. So in-home supportive services, or also IHSS, is a statewide program that's overseen by the California Department of Social Services and administered locally by counties. The goal of IHSS is to provide in-home care to older adults and individuals with disabilities so that they can live safely in their homes. The purpose is really to allow individuals to age in place and keep them free of institutionalization or out of care placement. Next slide, please. So how does one qualify for IHSS? To receive IHSS services, one must be a California resident. And IHSS is a Medi-Cal-based program, so all program recipients must be eligible to Medi-Cal benefits. We do request what's called a healthcare certification form, and essentially this document is something completed by a healthcare professional, and it indicates the needs of the recipient receiving benefits from IHSS. And then lastly, somewhat like I commented before, one must live in their own home and be unable to live safely without in-home care. Next slide. One of the most common questions we receive in IHSS is what services can my caregiver be paid to help me with? Well, that really depends on the needs assessment that's conducted. And that needs assessment is performed by a social worker who sits down with each applicant or each recipient to determine what kind of help is needed in the home. And based on that conversation, service tasks are categorized into pretty much 5 specific areas. And those being domestic services, so that includes your housekeeping, laundry, meal preparation, personal care services such as bathing, dressing, and grooming, assistance to and from medical appointments, paramedical services. People often ask what paramedical services entail. Well, these are tasks that would be invasive to one's body. So for example, if we have an adult who is diabetic and requires insulin injections, that person might qualify for paramedical services. And then lastly is protective supervision. Protective supervision is intended for non-self-directing individuals who may have a cognitive or mental impairment, and they essentially can't be left alone and require 24-hour care. So for example, an older adult with advanced dementia, or possibly a minor child who has autism in a very severe way might qualify for protective supervision. Next slide, please. So let's just quickly take a look at in-home supportive services in Stanislaus County. So approximately 7,600 residents receive IHSS benefits here in Stanislaus County. 55% of them are over the age of 65. The average authorization or number of service hours provided to each recipient is 97.6 hours per month. And in this county alone, we have 6,300 IHSS care providers. And looking a little further at the care provider dynamic or demographic, a good portion of them, about 75%, are family caregivers. And then you'll also notice on that second little pie chart there that of those caregivers who provide for a family member, about 58% are live-in care providers and 87% of them are family caregivers. Next slide, please. So in IHSS, we are very much a client-centered or client-driven program. And we recognize that one way to support IHSS clients is to also support their caregivers. So here in Stanislaus County, we initiated an MSW project with a focus on caregiver case management. What we did was we provided short-term case management to caregivers with an emphasis on caregiver emotional health and well-being. Those who participated were IHSS providers, primarily family member providers, serving high needs, severely impaired clients. And what we did was we used a caregiver assessment scale to evaluate caregiver stressors. Based on those stressors that were identified, we helped link caregivers to resources and services that might be beneficial to them. Our real goal was to determine the potential changes in the provider's self-perceived wellness as a result of having someone kind of guide them through processes and provide case management. We really wanted to consider the perceived challenges and rewards of caregiving. Excuse me, I'm so sorry. 1 second here. Let's see. The project really helped us reinforce for us the importance of caring for the caregiver. We often hear that, we care so much for our recipients, but it's so important for us to make sure we're caring for our caregiver as well. Next slide. So the IHSS Public Authority maintains a provider registry with the purpose of referring caregivers to those who might need one. So we talked a little bit earlier about the demographics of our caregivers. Most are family members at 75%, but we do have a segment of the population who may not have a care provider available to them. So the IHSS Public Authority maintains a registry to match a caregiver with a recipient. What we noticed, however, during the time of COVID is that there was a significant reduction in the interest of individuals wanting to provide care as an IHSS provider under the registry. So really what was cited to us were concerns about providing direct care to clients that were unknown to them or going into households that were not, that they were not familiar with. There was also reluctance on the side of recipients to welcome caregivers into their home. So what the program did, or what the California Department of Social Services did, was they really found a solution to help fit the needs, basically. And so they offer a wage differential to caregivers that are willing to provide emergency services to those who are without a caregiver during this time. This is just one measure that IHSS is taking to help ensure clients receive the care that they need and also to recognize the essential role of caregivers. Next slide, please. So how does this really all fit into the master plan for aging? Goal number 4, which is the caregiving that works. Well, the master plan for aging identifies 10 caregiving that works initiatives. And today we're going to turn our attention to 2 of those that are supported by IHSS. So initiative 107 states the goal is to promote paid family leave benefits. So currently, the in-home supportive services program offers sick leave benefits to all providers who are eligible. This began in July of 2018 and is something that the program is continuing to provide on an ongoing basis. And it's really an effort to provide for a healthy caregiver workforce and promote wellness within our caregivers. Additionally, through the provisions of Senate Bill 95, the in-home supportive services program is offering IHSS providers COVID-19 emergency sick leave benefits. And moving on to initiative 112, this initiative takes into consideration training for IHSS providers and looking at expanding online platforms to provide additional training and pathways or advancements for IHSS workers or any worker in the healthcare industry. So the state budget at this point in time has included funding for the implementation of what's called long-term career pathways. It's intended to incentivize, support, and also fund the career pathways for caregivers, as I mentioned, not just in IHSS, but also in other home and healthcare industries. This is something that's very new and is still in development, so there's much more information that will be forthcoming. Next slide, please. So finally, I wanted to leave you with a couple of items here. According to the California Department of Social Services, they project that by 2030, California will be home to an estimated 8.6 million Californians over the age of 65, many of which will be living among us in our own community. In-home supportive services has been a long existing and arguably the state's largest program that offers direct care to seniors and persons with disabilities. We're just one example, however, of how caregiving works. The NPA states California's in-home supportive services is a national leader in this model of care. But today we talked about not only housing, but at the very beginning, Jessica had made mention of all of the bold goals identified in the master plan for aging. So I thought it important to highlight that IHSS is not simply a program that could support caregiving that works, but in some way influences each one of the goals identified by the master plan. We had a really robust, nice discussion from our panelists about housing and how in this particular situation, ample affordable housing can allow our aging population to age in place and receive support from programs like IHSS. Goal number 2, Health Reimagined, that can help really provide health and quality of life, which IHSS performs as a home care program. Goal number 3 identifies inclusion rather than isolation. So providing caregiver support and engagement helps reduce social isolation and self-neglect. And then finally, goal number 5, which is affording aging. With IHSS, in-home care is attainable, making aging more affordable. So thank you everyone for your time this afternoon. I appreciate your attention and take care.
Thank you, Gina and Yi and Denise, all for coming and sharing with us today about caregiving, needs that are present and challenges here in our community, and how we can come together as a community to continue advocating for caregivers and their needs. At this time, I would like to invite Jose Michel from Community Services Agency to give us an overview of our eventful day.
Thank you, Jessica. Good afternoon, everyone. And first, I'd like to start off by thanking our wonderful panel and presenters for providing us such valuable information today. And thank you to the Stanislaus County Senior Coalition for coordinating our event. And also many, many thanks to all of you for joining us today on our kickoff to enact the Master Plan for Aging in Stanislaus County. You know, today we focused on 2 of our biggest priorities, housing and caregiving. And we heard from caring and committed elected officials and community partners that are addressing Goal 1, housing for all ages and stages, and Goal 4, caregiving that works. All of us in the aging and disability networks, we're all truly working together to ensure that Stanislaus County is a place where we can all age with dignity. My name is Jose Michel, and I'm a manager with the Stanislaus County Community Services Agency. And I gotta tell you that the Master Plan for Aging for me, and I think for anyone who works in this field, it's super, super exciting, right? It's really the first time that you can recall that there is like this concerted effort to coordinate this system-wide change that will enrich the lives of older people, persons with disabilities, and their family caregivers. Before the master plan, you know, most of us in the network, we were kind of working in silos, you know, focusing just on our own individual programs. I'll give you an example. I work in adult protective services. And when APS and its stakeholders first, worked to introduce the Elder Justice Act, we were really looking to concentrate only on elder abuse alone and not necessarily to coordinate with other partners in the network. Or maybe just another example, if the Department of Healthcare Services, if they made a change to a Medi-Cal regulation, they would just go ahead and make that change and didn't necessarily coordinate with other related associates. But the Master Plan for Aging has changed all that, and it's tackling and reshaping all these systemic issues with its 5 bold goals and 132 initiatives. Let me give you an example of what I mean. Take Goal 1, housing for all ages and stages. That's one of the goals that we talked about today. But let's zoom in and spotlight Initiative 9. Initiative 9 talks about increasing housing availability options with, quote, housing for health strategies. And they plan to do that through this anticipated federal planning grant. And they want to develop Medi-Cal home and community-based services roadmap, a roadmap. And in that roadmap, they'll have more residential options with additional and an additional new focus on Medicare innovation. So just by doing all of that, they take on housing, yes, but they're also taking on healthcare, social supports, caregiving, and affordable aging. They really are doing it all with that one initiative. They're streamlining all 5 goals in one way that will address all the different systems that impact older adults, persons with disabilities, and their caregivers. So that's just one example of how the initiatives and the goals are meant to guide service delivery and implementation over the next 10 years. And then you also really have to appreciate how there's this focus on inclusion, dignity, and equity. So again, super exciting time for all of us in this field. And I hope you join us in building our own local master plan for aging in Stanislaus County. With that, thank you all. Samantha, toss it to you.
Thank you, Jose, for your overview and support in planning this event as well. Next, we're going to answer a couple of questions that are directed towards Barbara. If Barbara, you are still available. And then by our next Senior Coalition meeting, we will have all questions answered. Responses will be posted on our website and sent out to all attendees here. Barbara, are you available?
I'm here.
Okay, excellent. So I'll ask you the first question and then there's a two-part question. So someone asked, they thought the housing list was closed and you can't go on the list. Is this true?
There's several housing lists, but most of the time when people are speaking of a housing list, they're probably talking about the Section 8 waiting list. Section 8 waiting list is only open for people who can apply for the in-place preference. So it's not open, but there is a partial opening. So if you have someone who is in housing and their landlord is willing to work with the Section 8 program, then they can get on the waiting list.
Thank you. And then the next two are in regards to the in-place voucher. So someone was asking, is there a waiting list for the in-place voucher? And then someone else asked, does a senior have to be on the waiting list in order to qualify for the in-place option?
There's no in-place voucher. There's an in-place preference for the Section 8 vouchers. And so, no, a person does not have to be on the waiting list. They can get on the waiting list, which I would suggest that they do. There's also open waiting list for farm labor housing, for larger housing, for 5 bedrooms. And also in Newman, we have some housing that has it called Valley Manor that has an open waiting list. So those are the open waiting lists now that people can indeed get on.
Okay, thank you, Barbara. I think that's all the time we have for questions today. All the additional questions that were in the chat will be compiled in that document by our next Senior Coalition meeting. And it can also be checked out by visiting our website. Handed back over to our coordinator, Jessica.
And if you enjoyed this conversation today and you want to continue being a part of the conversation regarding the master plan for aging, affordable housing, caregiving, we invite you to join the Senior Coalition of Stanislaus County to be involved in the conversation. You can email the Senior Coalition. Our email is listed there. seniorcoalitionsc@gmail.com, or you can visit our website for more information to see if this is something you would like to be a part of, especially if you provide services for older adults or persons with disabilities. You're more than welcome to join us and see what our meetings are all about and what you can be a part of to help us bring about change and help those in our community. And lastly, we want to thank everyone here today, especially the planning committee behind this Engaging Stanislaus, a Master Plan for Aging event. Thank you so much to the planning committee. And thank you so much to our speakers and our panelists for being here today and spreading your wealth of knowledge with all of us. Thank you to the Senior Coalition of Stanislaus County members that are here, and definitely for helping us spread the word about this event and all of the great information that was shared. And thank you to our community members who were here asking questions, being involved in the conversation, and being present today. So again, thank you so much. There will be a follow-up email sent out tomorrow. That email will contain an evaluation of the event. So if you could provide feedback, that would be helpful. We would greatly appreciate that. And then an email will be going out to let you know when the recording and the questions and answers will be completed. Again, you can look at our website, but I will send out an email when those are completed. So again, thank you so much for joining us today. And we hope you have a wonderful afternoon.